Good evening and welcome to the SVG-TV news for Thursday, September 30th. I'm Khalil Kato with the details. 2 more deaths here yesterday brings the COVID-19 death toll to 21. The latest 2 victims are men in their 60s who died from COVID-19 pneumonia. According to a release from the National Emergency Management Organization, NEMO, one of the victims, a 62-year-old male, tested positive for COVID-19 on September 14th, was admitted to the Argyle Isolation Facility on September 20th, and later transferred to the COVID-19 ward at the Milton Cato Memorial Hospital. The second patient, a 60-year-old male who tested positive for COVID-19 on September 25th, was admitted to the COVID-19 ward at the hospital. Both of the deceased reportedly had underlying conditions and were unvaccinated. NEMO also reported that 22 patients were admitted for COVID-19 at the Argyle Isolation Facility, of which 21 are unvaccinated and 1 fully vaccinated. 14 patients have also been admitted to the COVID-19 ward at the Milton Cato Memorial Hospital. 13 are unvaccinated and 1 patient partially vaccinated. 85 new positive cases were reported from 397 samples processed on Tuesday, resulting in a positivity rate of 21.4%. All cases are contacts of known positive cases and persons seeking care. 49 rapid antigen positive results were reported for the same date. 16 new recoveries were noted over the reporting period. 1,051 cases are currently active and 21 persons with COVID-19 have died. 3,508 cases of COVID-19 and 2,436 cases, that should be recoveries, have been recorded in St. Vincent and the Grenadines since March 2020. The health authorities say in view of the confirmed presence of the Delta, Mu, and Gamma variants in the country and the significant increase in the number of new infections, transmissions, severe COVID-19 disease and deaths, strict enforcement and compliance with all protocols and recommendations by everyone is strongly recommended. New health protocols were set out for members of Parliament today in light of the country's COVID-19 situation. The new protocols, which were approved by the Health Services Subcommittee, chaired by the Chief Medical Officer, were outlined to members by Speaker of the House, Rochelle Ford, who said the protocols are continually under review and are subject to change, either becoming less or more stringent.
The maximum number of members permitted in this chamber at any one time is 16, inclusive of 9 government members and 6 opposition members and the Attorney General, save and except in circumstances of the opening of the proceedings and in a division. Members will notice that a speaking booth has been installed in the chamber. This is for members' use, with only 1 member using the booth at a time. All unvaccinated members or members who have not revealed their vaccination status who wish to make a contribution, regardless of the length, will be required to utilize the speaking booth and to be double masked. Vaccinated members are permitted to make contributions from their respective seats and the member is permitted to move his or her mask for the duration of his or her contribution only if you so desire.
Ford told the members inside the chamber that it is her hope that the country, and by extension parliamentary operations, can return to a reasonable level of normalcy soon, but in the meantime, they must follow the rules.
But this can only be accomplished if we arm ourselves with the tools necessary to defeat the invisible enemy which this virus is. I encourage us all, the citizens of our blessed nation state, to pay attention to the advice of the medical officials, to continue to regularly wash our hands, wear our masks properly, keep a safe distance, practice cough and sneeze etiquette, avoid large gatherings, and vaccinate. I thank all members here this morning for your cooperation. I really am very satisfied with the full buy-in of members here today. And I wish you all continued safety as you discharge your duty to the people of our nation.
It was noted by Prime Minister Dr. Ralph Gonsalves that all members on the government bench were vaccinated and have already submitted the requisite documentation. On the other side, Leader of the Opposition, Dr. Godwin Friday, told the Speaker that while he understands that public health is the #1 concern at this time, a procedure which requires members to use a speaking booth as part of the new protocols will interfere with their proper functioning in the House, and asked that discretion be given.
And where it is rational and absolutely required, we could understand. But you've asked for members on both sides of the House to indicate whether they are vaccinated or also to have PCR tests. As far as I understand, all members in this House have complied with that. Some members, like myself, have both, because I understand that having the PCR test is the surest way of knowing what your status is, not being vaccinated. Is that not the case? Because unvaccinated or vaccinated persons can contract COVID and can infect other persons. So it begs the question then, why, if all members have been vaccinated or have had the PCR test, why some members would have to be banished to the Siberia or the box in order to make a contribution in this House, or to wear 2 masks? Nowhere else in this country has that been a part of any protocols. And in fact, I see in the protocols themselves, the suggestion is that the outer mask has to be black. I don't understand what the color of a mask has to do with public health. I would suggest that all members, whether vaccinated or unvaccinated, who have had the PCR test as well, whose status is negative, that all members in this chamber should be treated with the dignity of all members have the right to speak in the same way as any other member in this House, because it does not affect the public health considerations that we are seeking to address. And that has to be the only thing that we have to be concerned about.
In her response, the Speaker of the House said while she has certain powers of discretion where the proceedings of the House are concerned, she does not have that power in the application of the health protocols, and that they must therefore be followed. The opposition leader, however, noted that they must be careful with the examples set in the House.
I cannot think of a compelling reason as a responsible Speaker of the House to disregard the sound advice of the medical officers in a public health emergency. I actually want to leave with members, strange as it is, as I did my devotions this morning. 1 Samuel says, "It is better to obey than to sacrifice."
If members have proven that they are COVID negative, the justification for a differential treatment in an environment such as this really is difficult to see, other than to interpret this as some sort of measure to, to bring out from people information that they have not given, or essentially to name and shame. We can't have a situation, Madam Speaker, where
just a minute, Honourable
the public health consideration is not given the priority.
These protocols have been approved, discussed, verified by our chief medical officer, and we're abiding by them. And I really don't want to be left to think, because I don't think that that is your intention, that you're in any way suggesting that there is a motive other than the safety of the members in this House when those officers give the guidance.
When it was time for the question and answer segment, only the Leader of the Opposition, who is known to be fully vaccinated, stood and asked his questions from his seat. The other members on the opposition bench, whose vaccination status is not known, refused to use the speaking booth to ask their questions, which prematurely ended the session. Meanwhile, Minister of Education Curtis King outlined plans for the phased reopening of schools commencing next Monday, October 4th. In his ministerial statement, King said that phase 1 of the reopening will be done virtually for the next 2 weeks.
Is set to use the following models. 1. Online/virtual learning at all schools commencing Monday, 4th October 2021. And this will last for a period of 2 weeks. Thereafter, we would move to phase 2, which is a hybrid or blended learning, popularly referred to as on-site and online teaching. That is to say, a combination of both.
For phase 2, which may include face-to-face classes, the education minister said that the resumption of this teaching and learning process will be dependent on whether the school can accommodate physical distancing. He said the rotation of classes is another option, and priority will be given to students in the entry and exit classes.
Schools unable to accommodate full face-to-face engagement due to population size will have on-site classes on a rotational basis with greater focus on the entry and exit level. When we speak of entry and exit, we are talking about the lower classes, basically the grade K at the primary school and Form 1 at the secondary school entry, and the exit classes, the Form 5 at the secondary school and the grade 6 at the primary school.
Provisions have also been made for students who cannot attend schools. In such cases, Minister King says that learning materials will be provided. It was further stated by the Education Minister that all principals are required to make the necessary decisions that are most suitable for their respective schools.
Allow ourselves that flexibility to so organize our respective institutions based on the peculiar unique situation facing each institution. The respective school leaders of the various learning institutions will communicate the individualized blended approach or format for their respective institutions. So we are saying that we expect that based on the unique situation of each individual institution, they will obviously organize the format that is most suitable, and that would be the responsibility of the principal to make sure that that is communicated.
And Prime Minister Dr. Ralph Gonsalves, on a television program last evening, announced that teachers will be included as frontline workers who are expected to be vaccinated under the Public Health Amendment Act 2021. The Prime Minister said that the decision was made earlier in the day in Cabinet. He, however, noted that not only teachers will be required to be vaccinated at schools, but all persons who enter the compound.
NEMO, it was decided to put in these regulations to include teachers as frontline workers, teachers and those who working at the schools, the cooks and so on, everybody who comes in touch with children, students. The basic reasons for this, first of all, we know there's an uptick in the number of persons who are contracting COVID. The positivity rate is in excess of 10%.
In Parliament today, Minister of Education Curtis King reiterated his ministry's position that once face-to-face teaching commences, teachers will have to be vaccinated and all other protocols followed.
Whenever there's face-to-face instruction, whether it is under the blended model or full face-to-face instruction, given what is happening in the country, it is absolutely necessary that all persons who are using the school compound must follow these protocols. We have gone over them over and over: the hand washing, the sanitization, the testing on arrival, taking of the temperature on arrival, and so on.
The new regulations that will ensure all frontline workers are vaccinated are expected to come into effect in about a month's time. And while on education, the Ministry of Education has requested that teachers report their vaccination status and it has so far revealed that 39.4% of secondary school teachers, including TVET teachers, have been vaccinated. Reporting on the vaccination coverage of teachers today in Parliament, the Minister of Education said they have received 27 responses from the 29 secondary schools and 3 from the 4 TVET institutions.
Of 875 teachers, 345 were vaccinated, representing a percentage of 39.4% of our teachers vaccinated. For example, the St. Martin's Secondary School, of their total staff, about 38 persons, only 1 is not vaccinated. At the other premier boys' secondary school, the St. Vincent Grammar School, of a total of 57 teachers, only 5 of those teachers have indicated that they are vaccinated.
Minister King noted that not all information was received from primary schools. However, he said that the vaccination percentage among primary school teachers is encouraging when compared to secondary school teachers. Thus far, 25 of the 67 primary schools have responded.
We had responses from only 25 of the over 67 primary schools. That work is ongoing. But thus far, we have received responses from 477 teachers. Of this number, receive responses from only 302 teachers. And of this number, 175 are vaccinated, given a percentage thus far of some 58% of those teachers being fully or partially vaccinated.
The Education Minister said while he prefers face-to-face teaching for students, it cannot be done at this time due to the low vaccination rate, and again appealed for all teachers to get vaccinated. An investigation is underway into an incident involving an SVG aircraft at the John A. Osborne Airport in Montserrat yesterday. ZJB Radio in Montserrat reported that the airplane owned by SVG Air, one of 2 airlines that services the Montserrat-Antigua route, skidded off the runway on the eastern side of the airport. ZJB Radio said that according to official sources, 7 persons, including the pilot, were aboard the aircraft when it careened off the runway. ZJB Radio also said they were told that 2 persons were injured in the mishap. However, the injuries were not life-threatening. The governor's office in Montserrat expressed sympathy to all those involved in yesterday's incident at the airport and hoped that the 2 injured passengers will recover swiftly. The office said the UK's Air Accident Investigation Branch has engaged their local accident investigation manager in Montserrat to commence the investigation process, which began last night. It said a report will be published when all investigations are completed. The governor also thanked the emergency services and the airport staff who responded swiftly to the incident. Minister of Transport and Works Montgomery Daniel in Parliament today commended the Buildings, Roads and General Services Authority, BRAGZA, for the work it has accomplished over the past 5 months. BRAGZA was given the responsibility in the erupting phase of the volcano to upgrade the various evacuation shelters and also the responsibility of a $27 million cleanup operation after the eruptions. In a ministerial statement to Parliament, Minister Daniel said that though it was a challenging task for BRAGZA, the workers were able to complete the work to the best of their ability.
What tremendous damages that were done to the roads and to the bridges north of the river. And so, Madam Speaker, BRAGZA, even in its limited capacity, soldiered on to meet the mammoth task that was before it. But in so doing, BRAGZA would have employed almost all of the heavy-duty equipment that can be found in this country to help to do their best in the cleaning operations. And I really want to give kudos to them.
Minister Daniel further praised BRAGZA for the $2.4 million schools repair program and the project in building 4 new schools. He outlined other works that Braggs is currently engaged in with the Ministry of Health, the Union Island gas station, Her Majesty's prisons, and more, noting that the work of Braggs is enormous but commendable.
Kemp Bartholomew, as manager of Braggs. So you have done exceedingly well. You have done exceedingly well during these challenging times. And even in this time of COVID, you rose triumphantly, meeting the various levels of success for all of us. I'm sure all stakeholders are proud of your work. I know one songwriter said, "Put me to the test, and I will show you what I can do." Ministry of Transport and Works, we are proud of you. The government is proud of you, and I ask of you to continue to do work.
In light of the concerns for the sustainability of the wildlife population here, which was heavily impacted by the volcanic eruptions, the Ministry of Agriculture, Forestry and Fisheries today announced a moratorium on the hunting season for the 2021-2022 season. That extends from October 1st, 2021 to January 31st, 2022 for reptiles and mammals, and October 1st, 2021 to February 28th, 2022 for birds. In a news release, the ministry said observations and information received had shown that there is a reduced number of sightings of the wildlife species, and while they have seen a resilience in the forest since the eruption stopped, there are still concerns for the status of the wildlife as the availability of food and shelter for animals was disrupted, with 1/3 of the forest in the north impacted by the eruptions. The Forestry Department is asking persons to comply with the moratorium or the temporary prohibition to ensure the animals are there for future seasons. The ministry said there will be constant monitoring for hunting activities and also for the populations of the hunted species of mammals, reptiles, and birds.